So I'm Dr. Richard Weiss. I'm a specialist in physical medicine and rehabilitation. The field is also called physiatry. We're called physiatrists. We're a fairly new field, actually. So we actually have a fair bit of overlap with our orthopedic surgery colleagues and also neurology. We're a non-surgical subspecialty. So we take care of folks who sometimes don't want or need surgery. It's a fairly broad field, but the main focus is on restoring folks to their best functional capacity. So for physical medicine and rehabilitation, it's a 4-year training program. It entails a year of internal medicine or sometimes surgery. Some people do a year of pediatrics. And then it's 3 years of training after that, including taking care of spinal cord injury, brain injury patients. We also take care of, in the outpatient setting, concussion and musculoskeletal disorders. And some of that training actually involves electrodiagnostic medicine. We run the gamut of anything from concussion, brain injury, spasticity as well, things like from cerebral palsy or sometimes post-stroke care. We have a fair bit of overlap with some of our surgical colleagues, including orthopedic surgery, orthopedic spine surgery. We take care of musculoskeletal issues, weekend warriors. We also take care of some neurology overlap as well, some multiple sclerosis. We've got specialists who take care of, specifically wound care, some folks who deal with just pediatric patients. We also take care of amputee patients as well. Herniated discs, carpal tunnel, and other nerve issues, those are the things that we usually take care of here. We have the advantage of spending a little bit of extra time with our patients. We do a good history and physical examination to try to tease out where is the pain coming from, what limitations may the patient have, and especially what's the patient's goals. After that initial evaluation, sometimes we'll do some treatment in the clinic. We'll also do some other diagnostic tests. If they need x-rays, we'll order that. If they need an MRI, that can be ordered as well. If it's a nerve issue, we can do some electrodiagnostic testing as well. Here in the clinic, sometimes to rule out carpal tunnel and other issues. And then the other advantage is we have access to a musculoskeletal ultrasound machine here. So if patients are hurting or hear a click or some issue like that, we can actually do dynamic testing here in the clinic, which is a huge advantage. We take a multi-directed approach. We're sort of team leaders of a team that include physical therapy, occupational therapy, mainly trying to help people with their activities of daily living. And the main thing that we want to do is try to get folks back to as normal way of life as possible. So our key focus is on function. And that might entail non-surgical things such as injections, speech therapy, physical therapy, occupational therapy as well. And probably the number one thing that we're prescribing for folks, at least on the outpatient side, is exercise. On the inpatient side, we're also helping direct a team that might include nursing and also social work. The goal is to get patients back to their best level of function. If that's an amputee patient who wants to be able to walk around the mall, we aim to do that. If that's the weekend warrior who wants to be able to throw a spiral a little bit farther, if that's the grandmother who wants to be able to take care of her grandkids without having an aching knee or a hip, that's how we sort of drive our care, and that's how we try to better our patients.